Hello, everybody. I want to welcome you all on behalf of the entire FMCA team. I'm excited that you're here, and we're going to talk about how to create impact as a coach and answer your questions about functional medicine coaching. So let's get started. I'm going to share my screen because I have some slides. Oops, wrong slide. So I was going through my slides before we started, so you got a sneak peek. So there we go. All right. We're going to talk about what I think are 10 really important steps for creating impact as a health coach. And these steps come from many people on the faculty of our new business building track. So let's begin. So step one, this is from the heart. It's having a sense that you're meant for more. This comes from Lisa Sasevich, who's on our faculty, and she talks about not wanting to live a woulda, coulda, shoulda life. To really make that commitment to be where you want to be. That you have a sense that you're meant for more wherever you're at right now in your life. You maybe know that you want to make a huge difference in the world. Abundance of ways you can be of service. And what happens with that sense? Well, as you develop that, you will receive abundance in return. And there are different ways that we acknowledge and have abundance. There's certainly financial abundance, but that's often not the motivation that leads to business success. It's starting with that vision, knowing that you can be of service, and what you get back, that sense of abundance, is in relationships, in the community that you're now a part of, and in the lives that you're impacting. So you wake up every day with a good feeling in your heart, and that's something that I really wake up with. And my co-founder, FMCA's co-founder, I should say, Elyse, who is on the call, so she's here, and I was remiss in not introducing her at the beginning, but she's going to speak later on many different ways that you can join us at FMCA and tell you about our team. So step two is designing your dream. So you have the dream, you know you meant for more, and now you're going to design what you want. And this comes from Mary Morrissey. So Mary says transformation requires that we not just have dreams, but that we turn them into reality. It starts with your personal vision, and it starts with knowing where you are. But knowing where you want to end up is really more important. That's the dream. Then there's the navigation. And what is that? That's designing the dream, getting to the specifics of designing the dream. Where do you start? Well, what do I love is a good place to start. But that might be hard for you because maybe you have been trained to believe that you have to start with what can I do? And that could be very limiting. You might feel, well, I don't have the training, I don't have the education, I don't have the financial resources, and then you get overwhelmed and you don't start. So this can apply specifically to your coaching dream. If you have a passion for making a difference, and actually people at FMCA, our students, graduate, the one factor that unites them is that they all feel they are passionate, they have a calling to serve. But how are you going to bring that into the world? Well, that means you design the specifics of your calling. In other words, you design from the get-go what you want your business to look like. Where are you going to work? How many days a week will you work? Are you going to be working from home? Are you going to be working with a doctor's practice? Or are you going to be starting your own business? So you design those specifics before you begin. And something really important, which comes from Denise Gosnell, is that you don't want to forget your life. You create your business around your life. And for me, and I think I speak for Elyse as well, we merge our business with our life. And that is actually the way that you have joy. In other words, when I am working, I have so much joy that it's a major part of my life. It's part of my self-care. That happened at a meeting with our team where I was overwhelmed with just positive feelings. And then when I am out living my life outside of my normal, quote, work hours, well, I get creative ideas. And I get very excited. Elyse and I often have a lot, we'll text each other on the weekend. And even though they've heard, oh, that's bad, you have to quit, and have complete playtime. But we get so nourished and so excited by thinking about how we can grow and have new ideas and have better ways to educate and serve our community. So step 3 has to do with your unique value. Finding that. Where do you find it? Well, I should back up. Before you find it, there's something really crucial you don't want to miss. And that is there's a first obstacle to overcome, believing that you have value. So the first person you sell to is you, because we often have doubts and insecurities. But we all have that unique value. It's based on our stories, and each one is different. How you came here, how you came to become a health coach, how you came to grow your business and expand your reach. You embrace all your experiences. That means certainly your formal experiences, but those often aren't the best place to start. It's really informally. It's everything you've learned along the way, the people who have been most influential in your life, the books you've read, the experiences that you've had. It all matters. As Chris Smith says, the only thing you have to differentiate yourself is your story. And then you pick a group. Who do you want to serve? So you have a calling. Who do you want to serve? And you go all in because you want to have you want to make a difference with this group. So that answers the question too, what do I do? And that is called the elevator speech. And I could have said, if somebody asked me, what do I do? Could have written, well, I'm a founder and CEO of Functional Medicine Coaching. That's like a resume. And this is what Chris suggests to have impact. You start with I help. So here's mine. I help people become functional medicine health coaches because I believe that training thousands of coaches around the world is the solution for overcoming the chronic diseases that are killing us. So you want to find a bold statement, put yourself out there, and it's based on I help and I believe. What's your mission? That leads to step 4, showing up to give. We're talking here about hospitality, and this comes from Michael Fishman. What is the emotional experience of doing business with you? So, hospitality. We are committed at FMCA to hospitality from the get-go. It's part of who I am, who Elyse is. It's part of our core values as a company. That is, we want to lead with generosity, to contribute before asking for something, give value first, be a giver, not a taker. And hospitality is when somebody is perceived as the experience is happening for you, not to you. In other words, not being sold to. And we're really committed to teaching that in the business track so that you can have a successful coaching business. Step 5 is enact your vision through what? Through your capabilities and your reach. Dean Jackson, who's one of the most renowned marketers in the world, talks about this. It's VCR, the VCR formula. We all have this combination of vision, capability, and reach. So we all have assets in these areas, but you might be stronger. Many of you probably have a stronger vision. And where do you need help? Well, maybe it's capability. So maybe you would get training. You could come to our program. There are trainings that can help you in many different areas so that you feel more confident. You can also get mentors, which we'll talk about as well, for example. But maybe you don't have the reach. So maybe you want to look at ways that you can extend your reach. And fortunately, there's a way to do that. And I love this. If you have the vision, you can be a player in the free zone of Cloudlandia. We are all citizens of Cloudlandia. So 10 years ago, 20 years ago, we were citizens of the mainland primarily. And the internet was just something out there, something extra. Well, now it's reversed. So I consider all of the opportunities that are available in Cloudlandia. What are those? Well, these are all for free. You can get video conferencing like Zoom. We're all in one giant meeting right now. YouTube can be your TV station. You have a radio station if you start a podcast. We just started one, What the Funk. We are now a radio station. You have blogs that you can write. Now you have your own newspaper. You have your own mail system with email. So your ability to extend your reach is getting so much easier. But there's something that can get in the way. That's step 6, acknowledging these unpleasant feelings. Because if you're going to lead with generosity, you're going to engage with clients, you're going to build referrals from doctors. Well, the truest expression of caring is when there's no other agenda. What could that mean? It means if you're desperate for a client, if you're scared. There are 8 unpleasant feelings, according to Dr. Joan Rosenberg, who's also on our business faculty. What are they? Sadness, shame, helplessness, anger, vulnerability, embarrassment, disappointment, frustration. We all experiencing them. They're normal. They're something that happens to us, but we can learn, we can train to move through them. And how do we express them? How do we acknowledge them? How do we let them go and accept them? But what actions might stem from? Maybe it interferes with our effectiveness. And so we talk about doing the work beforehand. In functional medicine, we call that gathering yourself so that you don't allow those comfortable feelings to get in the way with your encounter with others. And part of that is the more open you are to a no, the more likely you are to get a yes. So it's extremely important for business success. Here's another step that's so important, step 7. Sales is an opportunity for transformation. Your customer, client goes through a transformation. And so that is really what you're selling. A lot of people are scared of selling. They have a negative opinion. They think like snake oil, it's evil. But what are you really doing? You're educating. And you're educating people because you want the best for them. And one way of looking at this is really you have an obligation to tell people. If you have a product, if you have a service, if you have something, then we all have what people need right now in terms of where we are at with the pandemic, for example, and other issues that are coming up. If we can help people, we have an obligation to tell them how we can help them. Sometimes we need some more help, and the best way is step 8, collaborating. J.J. Virgin says that we'll all have more because we're doing this together to make a bigger impact. We can do so much better together. It shortens the learning curve. We get feedback. We share ideas. We test things out. And we don't feel isolated. We're a whole community. And immunity is community. And we're all interested in building our physical and our psychological immune systems, which we teach the psychological immune system through positive psychology at FMCA. 9, you continue to learn. JJ says having a coach from the beginning, staying connected to a great community. So you learn and get support, others, continuing to develop your skills, getting a coach or a mentor. We offer that through our alumni program. And you join a group of people who are where you want to be. That's something else we do in our alumni program. We can have you connect with other people as mentors. It helps you grow and holds you accountable. And finally, you look for what's called ethical opportunities, even in times of world crisis. So this comes from my friend Joe Polish. He's been saying this for years. If you have what people need, you don't need marketing. And guess what example he would use? And he's used this example since the 90s. Well, if you have toilet paper, you don't need to market. You just put up a cardboard sign, I have toilet paper. So I ask you, what do you have that humanity needs right now? And don't wait. Mary Morrissey says, if I waited to make an impact in people's lives until I was perfect, I would still be waiting. And she is one of the greatest leaders out there in helping people live their dream. So this is the dream that Elyse and I started. This is what we had. We were in this building. This is the North Suburban Wellness. It's in a suburb of Chicago, Highland Park. And this was a place, I had an office. Elyse worked with me, and we felt that we were meant for more. Is that right, Elyse? And so, well, how are we going to do that? It went through many different stages. This was one of our first. We had our Feed Your Mind Wellness aprons. We partnered with a local grocery store, an integrative medicine doctor. That's Leslie Mendoza Temple, Northwestern Hospital. We did smoothie demos, recipe demos, healthy snacks, and we had an audience. We were so excited. Yes, we're getting out of the office. We're going into Sunset Foods, and they might have an article about us in the newspaper. And then we thought, well, what we know would work really well in corporate wellness. So there was an event that was in downtown Chicago, sponsored by Crane's Chicago Business. And so we had a nice banner, we had flyers, and you know what? Didn't go very well. The amount of engagement we had afterwards, I think we got a couple of companies who wanted to follow up with a lunch and learn, but that was about it. So, love this quote from Joan. We disappoint our way to success. So we were disappointed, but that didn't stop us. We kept going. And along the way, I happened to get to know Dr. Mark Hyman. And one day I asked him for something, and this was actually way back. This was around 2011, way before FMCA was founded in 2015. And I asked him, and I was sure he would say no. I asked him if he would come to Chicago and help me. We were doing a version of the Daniel Plan, which was something he started with Dr. Daniel Amen and Rick Warren of Saddleback Church. And I was going to start this for our community in the Chicago area. And he said, yeah, I'm there. I'd love to do it. And so I was bold and I was perfectly, I had talked to myself beforehand, like, yeah, he's liable to say no, but so what? I'm going to go for it. And then we went a little further, and this was around 2014, and we thought, what if we created a program to teach health coaches, taking all of these pieces, putting them together, functional medicine. I had just graduated from IFM as a certified practitioner, and Elyse had taken some training, and she has her nutrition background, and we have positive psychology, psychology of eating, mind-body medicine, which I had focused on for many years as a clinical psychologist. So we had this idea, and we met with the leadership of IFM, and some are pictured here: Lori Hoffman, Dr. Christy Hughes, Dr. Patrick Hanaway. You know what? They went for the idea. And now all we had to do is build it. So start before you're ready is another key strategy. And we had a lot of support. Dr. Jeffrey Bland from the get-go loved the idea of training coaches as we became a collaboration with IFM. Dr. Bland, as you may know, is the father of functional medicine. And who do we really appreciate? How have we grown? What do we attribute the success of FMCA? Well, yes, the leaders are important, faculty is important, but there's people, our team is very, very important. That's our course facilitators, our students, our graduates. So I'm going to turn it over to Elyse to share about our community, our global community.
Hi, everyone, and welcome. Thank you so much for taking the time out of your day to join us. And I loved all of those points. It's beautiful. And what is great about that is we all, Sandy and I, we stand in those, all of those steps and in those values. And so does our team. And just like what Sandy was saying is we have a tremendous community. In fact, we actually call it the FMCA family because we truly are a family. I think you could probably go to every single state in the US and over 34 countries worldwide, and you would have a family member. You would have someone who's gone through FMCA as an alum, who's going through FMCA, or is somehow connected. And so this has been a global community that has grown over the years. And speaking of, I also wanted to share one quick little tidbit to stay tuned with us because we do have something special to share towards the end for you all. But one of the most beautiful things about the community is that it starts at the very beginning. So if you're with us on social media, it can start there. But to get a real connection and to have a real touch point with someone, we have a global admissions team. They are all graduates of the program. They are from all different backgrounds and have a variety of experiences, but they all come together to share a passion. And really, it's their heart is to serve. And they have a passion for functional medicine and positive psychology. That's what has gotten them here. And so specifically, this is a picture of Manaz, and she is in the blue and white, beautiful scarf. And she, this is a picture, I believe it was taken in South Africa. Now, Manaz lives in Saudi Arabia, and she's on our admissions team. She is our international coordinator, which means she holds monthly meet and greets for our international students, office hours for our international students, along with the course facilitators that we have all around the world. We also have another admissions team member from Australia, many, many students from Australia and the UK. And what is great about these conversations is you can come to these conversations and, like Sandy was just sharing, you can be vulnerable. You can come with some of the uncomfortable feelings and talk those out with our admissions team. They're there to fully support you. They're not there to sell. They are really there to educate and guide you and really support you on your way. And they are really, we were having a meeting earlier today, and Manaz actually was sharing that one of the prospective students she was speaking to said, you know, I feel like I'm getting coached right now. And it really is an extension of coaching, and it's just who we are as an organization and how we operate and just modeling that behavior. So with that, I will turn that back over to Sandy. And again, thank you all for being here.
We love Manaz. We love all of our course facilitators and everybody on our team. Kudos to Erin, who is behind the scene. She's backstage there, coordinating everything. And this is every time our live training sessions end, it's so emotional. This is one example. These were students who worked together all year long in a cohort group. They got really close, and they got really close to their course facilitator, in this case, Manaz. And so this is something they created. In the past, we've had people create videos. They get together to say thank you. And there's a lot of tears at that last meeting. They don't want to leave the group, and often they don't. They stay on to form get-togethers and stay accountable to one another. Some have even entered into some joint projects, that idea of collaboration. You can collaborate with fellow students, now graduates. So, and finally, step into your meant for more and leave that woulda, coulda, shoulda behind, from Lisa Sasevich. And I just had to throw this picture in because this was the last time that I was together with colleagues. It was the end of February at the Integrative Healthcare Symposium in New York, and had a transformational experience meeting with Dr. David Perlmutter, his son Austin, Dr. Joel Evans, who is our director of curriculum, Dr. Monique Class, who is our director of coaching development. And we had big ideas, and his latest book is Brainwash, and was so excited because he understood the connection. The main theme of his book is that what you do, what you eat, your lifestyle, that's so tied in with your brain state, specifically your ability to make good decisions and regulate emotions, to deal with those uncomfortable feelings that we just described. And so he was really excited about working with us, and we had big, big dreams. And I like to think that those are just, temporarily paused because of the pandemic, but we continue at FMCA to dream big, to have bold ideas, and find ways to serve you. We really listen to our community, our students, our graduates. What do you want? So, closing, wake up in the morning to create impact, and stand in the future and ask, what steps will I be happy that I took today? So you step into the future and say, standing from that future, what will I be happy that I did today? So thank you. And with that, I'm going to turn it back to Elyse, who can open up some of the questions. Thank you all for listening, and thank you for submitting questions.
Yes, thank you for all of your questions. And just to share, if you are curious and wanting to speak with someone from our admissions team, I really encourage you to email us. And you can email us at admissions@functionalmedicinecoaching.org. You can also set up a time to speak with one of our admissions team members on Zoom, just like this. And if you're lucky, we might be able to connect. There might be some people on tonight that we've chatted with as well. And I personally love connecting with you all, with prospective students. I love hearing your stories, what brought you here, what your visions are, what your dreams are for the future. And I just really encourage you to take the first step, because I'm sure if you are here, you all have a dream for what you'd like to do and how you would like to shape, what healthcare looks like in your communities, or maybe in your family, or with clients or patients that you're already seeing. And so if you're in that dreams stage or space, I encourage you to take that next. It's oftentimes scary, and it's that first step. And sometimes it's just picking up the phone to call and talk to someone. And so I encourage you to do that. So the email is right on the screen, and we'll be sharing it throughout. So again, thank you for all your questions. We're going to dig into the questions here. I know a lot of you had asked questions about the duration of the program, the cost of the program, if there were any payment plans, and I'll briefly just share that with you all, but also let you know that all of this information is on our website. You can just head over to functionalmedicinecoaching.org. You can click, there's a programs tab, click on that, and then you'll see the coaching certification tab. You'll want to click that, and you can download our information packet. It is full of awesome information. But to share a little bit, so the program is 12 months long. We have 2 start dates, but we are in enrollment for our September 2020 class right now, which is so exciting. And typically, There is around 40 hours worth of content within every single month. And one of the biggest questions we get is, well, how can I do this if I've got a family and a full-time job? And I'm here to say that we have a lot of students who are in that same position. And typically it's around 10 to 12 hours a week that they're investing time-wise in the program. And we do have payment plan options and different alternatives. And I really encourage you to download the information packet and also to connect with us and email admissions, and we can go over that with you personally as well. So to dig into some of your questions, this is a really great question. And Sandy, I'm going to throw this over to you. It's, what would my daily responsibilities be as a health coach?
That's a great question, and it depends on where you want to be. For example, if you want to be working with doctors, perhaps what you do is lead groups. That is huge right now as we look at bringing functional medicine and coaching in particular to many people and affordable access. Groups so powerful. It's the community that's so important. So you could be leading groups. You could be going to one doctor's office and leading a group. And one way is that perhaps that's your day. You would have individual visits, and you would have group. Right now, and probably for some time to come, it'll be virtual. And so you could be at home and you would have one-on-one sessions with referrals from that doctor, as well as leading groups. Perhaps you have contracted with a number of doctors, and that could be anywhere in the world because you can work virtually. That's how we train you. And so you could be seeing patients from a lot of different practitioners. Or you might be somebody who likes to go out and educate the community. So your day might be more of an entrepreneurial position where you're going out, or right now you're virtually in your pajamas and you're doing talks. You might be, we have some graduates who are participating. They're podcast guests, they're writing blogs, they're writing a cookbook. We have a group of graduates who got together to do that. So it's only limited by your imagination. And I would urge you to go back to Mary Morrissey's question, what do you want your day to look like? You get really specific on that, and then that will be the steps to make it happen.
Yeah, absolutely. In fact, I was just, before we got on the call, I had popped in our FMCA Facebook students group, and someone was just sharing a huge win that they had left their corporate job after 16 years, I think, and had finally lifted up or lifted off the ground a whole coaching program that they had created. So you can absolutely, the sky's the limit.
Yeah,
you can really create it. Yeah.
Maybe you're going into schools, maybe you're going into corporations.
Mm-hmm. There's so many possibilities. And also the admissions team is happy to help you explore those, even if you just need a sounding board to talk those out. So the next question is, what are some of the major clinics where FMCA trained health coaches are working?
So we have trained the coaches at Dr. Mark Hyman's Ultra Wellness Center. We've trained coaches at Cleveland Clinic Center for Functional Medicine. Some of the other major leaders in functional medicine, Dr. David Jones, who's one of the founders of the Institute for Functional Medicine, and his partner, David is retired now, but Dr. Michael Stone has a coach. She was in our beta class, which started our first little group of 26 students around 5 years ago. Dr. Shilpa Saxena, also, Dr. Joel Evans has coaches in his group in Connecticut. Dr. Betty Murray, I think she's a doctor. She's a nutrition background, but yeah, but she has coaches. So, and what is so wonderful is that we are seeing an explosion of interest. So because we are so privileged to be partners with the Institute for Functional Medicine, they are training doctors, and from the get-go, the doctors are learning the importance of starting their practice in functional medicine with a coach.
Yeah, and just to add to that, I think it was last September, there was about 9 or 10 nurses from a big hospital system in Monterrey, Mexico, who all decided that to get together and come through the program. So we're starting to see that, and it's very exciting.
We also have a bunch of nurses in the Philippines who came and studied as a group through a local organization there.
Yeah. So the next question is, do you teach people other than doctors and nurses without their education to become a health coach?
Absolutely. In fact, many of the doctors and nurses who come, and we have quite a few, but they're experts. They were trained as experts. And so they have to do a lot of unlearning to learn the coach approach. But we have so many people, it's probably about half, who have no formal training whatsoever in healthcare, but they have something so important. They have a calling to serve, and they know how to listen. And that's what it's about. It's listening. It's honoring the person in front of you. It's your client's journey. It's not up to you to be the expert. And so absolutely. So if any of those 8 uncomfortable feelings come up, or I don't have the capabilities, I would say you have exactly the capabilities, and we'll do the rest. We'll give you the skills.
Yeah, absolutely. And just to add on to that, I would say about 40% of our student body are coming from backgrounds that are not healthcare related. We have engineers, accountants, marketing experts, farmers, we have teachers, we have, I think there was someone from the, post office. So, that was their background, and it's okay. And they come with this, like Sandy said, this passion to want to serve. And for functional medicine, they may have came to functional medicine or found functional medicine through their own health journey. And they have just been so moved and transformed that they want to help others.
We have Broadway actresses. We have former professional dancers who are becoming coaches, yoga instructors, Pilates teachers. So people who are at home homeschooling, for example, are coming to us, educators. So it's an endless list.
Yes, absolutely. And this is a great question. Thank you for whoever asked this. Are there successful male functional medicine coaches? It looks to be a predominantly female environment.
We have males, and they are growing, and they are so badly needed. We have a specialty course in men's health, and male coaches are really, really needed. And we have great ones. We have people ranging from, they've been teachers, they've high school teachers. We have entrepreneurs. We have people who are drawn to health coaching to blend with what they're already doing. So yes, we love our guys, and we want more.
Yeah. And I think there are just, so many opportunities for everyone to come into the environment and just make their impact.
We have a lot of retired gentlemen, so former doctors who want to stay in healthcare. We have people who are in full retirement. We have a charming couple in their 80s, several of them, and they decided that they are going to do this coming out of retirement. And as again, we talk about feeling the abundance and having a mission and purpose.
Yes, absolutely. So with that mission and purpose, one of the big questions is, what are those job opportunities? Who actually will hire a functional medicine health coach?
Okay. Well, this is where our collaboration with IFM is priceless, because we meet regularly. I meet with Amy Mack, the CEO. They are 100% committed and value our partnership. And so I've spoken from the stage on the value of having a coach. And so those members of IFM, they're attendees at the annual international conference, they're interested in hiring a coach, and they come to us. Why? Because our graduates speak that language of functional medicine, the same language they were trained in. They are learning from, they know that the material that they got while they were going through IFM, it's the same faculty, pretty much the same slides. We modify it to be coach appropriate. So that's one. There's also growing interest amongst corporations, corporate wellness, and there's growing interest amongst companies. So before this webinar, I was on a call, and we were talking about the rapid explosion of patient remote monitoring. You've got your watch, you've got your continuous blood glucose monitor, CGM. This is just exploding, and every day there's new advancements. And so who's talking about health coaching? It's government programs, Medicare, Medicaid. There are large hospital systems, and there are doctors that we are associated with who are working with these large agencies where the coaching in practice will be reimbursed, leading group medical visits. And so it is extending way beyond functional medicine. There's a big surge, and especially now, there are more and more people. So maybe if we were having this conversation 5 years ago, when we first started, we wouldn't be talking about this surge. We were hopeful, but now we know. And we've seen the numbers. We've seen what's happening, and coaching has been identified as one of the top trends in career growth because of the pandemic. People are aware of their health, and particularly that it's these chronic diseases like obesity, type 2 diabetes. These are the lifestyle diseases where coaches can have a significant impact. So people are waking up to say, this is where we need to be. This is the strategy so that people will not be succumbing to the worst outcomes with COVID-19 because of these chronic conditions. So therefore, everybody's interested right now in health coaching.
Yeah, and this question dovetails a little bit, Sandy, but the question is, if you live in a city where there's no functional medicine doctors to support, how can you thrive as a functional medicine health coach? We kind of answered this, but
Yep.
Go ahead.
So think back to my talk, you are a citizen of Cloudlandia. And what's happening is that the barriers that existed, especially for practitioners, are coming down. So coaches were always able to do telehealth. Medical doctors could not because of their license, but that's all changed. And we're going to see this transformation in the way healthcare is delivered. And so you can go anywhere in the world as a citizen of Cloudlandia. You can get on your Zoom, you can have sessions, you could be in one place, and your client or the doctor you're working for could be way in another part of the world. We are seeing this, and it is increasing in numbers. You can lead groups as well, so you don't have to be concerned anymore by limiting to your region.
Absolutely. And this other question, so I know we have a lot of nutritionists or nutritional therapists tuning in, or maybe registered dietitians. So I've got a nutrition and psychology background. And this question is, how would this qualification, becoming a functional medicine certified health coach, help me grow my nutritional therapy business? Sandy, I'll let you answer that.
Yes. So first of all, we have many people who have this background. And when you learn the coach approach, you can blend it. There's several ways. One is that when you are doing a nutrition consult, you can use coaching questions like, what matters? Have you thought about what matters most to you? Have you thought about what you want your health for? And so you bring that coaching conversation into something that's billed as a nutrition consult. That's one model. Another way is perhaps you've identified people who just want coaching. So now you have a client agreement that states that that person is engaging your services as a coach. So now you wear a different hat, the coach hat. And that session will not be giving dietary advice. It will be related to exploring the client's goals, which may not be related to nutrition at all. So you can do both. And psychologists, I was a former clinical psychologist and know that world very well. And yes, you can, it depends on what you have your client agreement for. And that's something that we teach. We teach very specifically in our new business building track, how you do that in a way that you will stay safe in terms of your professional license.
Yes, and that totally matters. And I'll just add in having a background as with nutritional science and dietetics. The one thing I was always hungry for when I was in school was okay, this is awesome education and information, great science-based, evidence-based information. But how do we get these people to start making transformations and change? And that's really, when I was in my undergrad, that's really the question that kept bubbling up. And to be totally transparent, we didn't really get that kind of information or education during my schooling. And so I was hungry and I kept searching for more, and very, very lucky to have found a double program that offered holistic nutrition and clinical health psychology and really bridged that gap. And so I would say, as I talked to other nutritionists and RDs and other colleagues in the field, they found that that's very similar, is they're missing that piece. There's that gap of how do I really meet someone where they're at? And how do I get those skills and tools to help others or motivate others to make changes? And that is where positive psychology comes in and really blends beautifully with functional nutrition and functional medicine. And I'm very proud to say you will absolutely get those skills and tools in this program. So the next question, this is really a great question. And so how do you help students get volunteer coaching clients?
Well, this is something that we really promote, and we have at the end of the program when you are through with all of the requirements and you are ready and we would look at your community. And so we teach that, how to go out, find volunteers. We have something really special right now that is going to continue, and that is offering free coaching. And so we have a whole alumni department, and we have people calling in. They may want to coach for themselves. They might be a provider wanting a coach for their office. And so we will make that happen. And we're seeing a tremendous surge in interest for free coaching. So we teach you how to do that. And often people will look at different ways. If you're still a student, you coach each other. And that's set up through the live training sessions. And then you may coach somebody. We've had people post in our own Facebook group, hey, I'm logging my hours and I need a few more hours who would like to be coached. And I might add that we are a fully approved school by the National Board of Health and Wellness Coaching. So this is the national board that sets the standards for what does it mean to coach with integrity? What type of training do you need to have? And so it means our graduates can sit for their exam. That's a real plus to be a board certified health and wellness coach. And that's where keeping the log will come in. If you want to know more, I encourage you to go to their website. It is NBHWC, the National Board for Health and Wellness Coaching.
Yes, .org. And the next question, we get this question quite a bit in admissions, and we've answered it in a couple different ways, but we'll bring it together. But it's, how is FMCA truly different than any other health coaching program out there?
We are in collaboration with the Institute for Functional Medicine. We are the only program that is their collaborating partner. They are the gold standard for educating practitioners in functional medicine. They have a huge group of practitioners who have been trained, who are members, who come to them. They just had an annual international conference that we were part of. They had over 1,000 participants, 200 were new. It was virtual. So we are proud to be their partner. They have been guides, advisors. They helped us to design the curriculum. They are really crucial. Our faculty is their senior faculty. We get their courses, their slides, and we modify them so that they are appropriate for coaches. And we also blend this functional medicine philosophy with positive psychology. So I have been an expert in that area, as well as an expert in mind-body medicine for many, many years. Going back to the 1970s, I was teaching. I still have the old notes of, I was teaching doctoral students mind-body medicine. It didn't have that name yet. We didn't have a name for it. We didn't have a name for positive psychology. But it's just thrilling to see these principles, these ways of helping people catch on. And so I feel that we are really experts in that space. I was also an educator before I was a psychologist. So we have our team, many people on our team have been educators. And so, but I think the one thing that really I like to say, and I think Elyse can attest to this, it's our passion. It's our sense that everything we do is looking at how can we help you grow, and what we do as a team, everything that I learn in terms of business management, I pass along to you now that we're building our new business building track. Elyse and I have office hours, and I think that's something else that we've been told distinguishes us. We are personal, right, Elyse? I mean, we love to just, our office hours, we love to really nurture everyone who becomes part of our family. We feel like it's from the heart, and that's the title of our business building, building a business with love. And that's how we did FMCA. That's what we now want to teach you so that you can go out and have a successful business.
Yeah. Yeah. I would add to that, if community education is probably something, I'll just go ahead and make an assumption. I don't like to make assumptions, but if you're looking into a coach program, I might assume that you like or love education or a love of learning. But like Sandy said, there's so much support in the program from the get-go, with admissions and having someone support you with your questions, all the way through course facilitation and meeting with your group, your cohort 3 times a month, now for 2 hours at a time, where you are really being able to practice all of your skills and tools. So there's a ton of implementation in the program so that you come out as a confident coach, and you know how to coach, and you're compassionate and competent as well. But there's support from the Facebook groups, and then, like Sandy said, our office hours. And community is just huge. We really value that a rising tide lifts all boats. So we are always here. So you will see Sandy and I in the comments in Facebook. We are very present, not because we have to, because we want to be. We love it. You will talk with me on an admissions call. You might even get a phone call from me. And of course, if you say it's okay, but yes, we're just present, and we're here, and we absolutely love watching and helping and serving you. So.
And I'm committed to doing it personally. So it's not a bot or somebody else who's responding in my name. It's me. I go onto Facebook. I respond. Just this afternoon, I responded to somebody who had reached out, a former student, and had a quick question. So I love doing that. I love staying in touch, staying connected, and helping, often connecting people. If there's somebody I know, a doctor, and there's a coach that has a specialty, I'm a matchmaker. I love connecting and putting them together.
Yes. So I would ask you all and encourage you all to just, figure out what is important to you, what aligns with you. If community and education and support is something that you value. And it's not just support during the program. It's actually, there's support after the program. We can talk about that around the alumni program and what you receive, and what we continuously are doing to just grow our community. And really to help you grow. Did you want to say something, Sandy? Sorry.
No, I'm
okay.
I'm done.
There's another question regarding, what do I do after? This is perfect. What do I do after the program? Is it possible for me as a functional medicine coach to further my development and skills? How would I do that?
Yes, so you can stay on. We have a very, very active alumni membership program, and you have access to experts. We have world-class leaders who come on. We have our faculty who come on, is Ask the Faculty, Ask the Expert, and you can get mentoring. You can come to my office hours. And many people informally also form their own. Often it's a cohort group that decides to stay together. And so that's one way to get support. We have a growing number of specialty courses. We have a few now we're building. We have a lot of ideas for building more, and those will be for continuing education. So I spoke earlier about the National Board of Health and Wellness Coaching. So after you graduate, we would encourage you to seek board certification. And then for that, once you are board certified, you need continuing education hours to keep that credential. And we are offering it. We will be offering a lot more opportunities. And so that is a way. And we are also looking for people who want to stay on in a more formal capacity. So we are growing around the world, and many people are committed to our team. They are becoming course facilitators, for example. So there are many different ways, and many people submit ideas to us as well, how they can be a part of FMCA.
Yeah, just like we teach listening, we listen. We want to hear from you and how we can continuously make your experience better, more positive, and the best that it can absolutely be.
We were having live meetups, and I hope, pray that we will resume those. We'll have virtual meetups, but that was something I particularly loved, and having meetups that were live, and hopefully that will happen in our future.
Yeah, and that actually brings me to the next question. We just have a couple more questions. But this is someone who wrote from, I'm assuming, Malaysia and in the Southeast Asia countries. And this really actually goes for anyone all over the world. They're wanting to know if they can belong to a health coaching community in that specific area. And I know there was a couple other questions of, do you have coaches in Poland or France or Germany? And the answers are yes. And also, like Sandy, she shared, we used to do the live meetups, and right now those are just put on pause. But what you can do is, if you're interested in speaking with a current student or an alumni of FMCA in your area, or maybe in the same country or state as you, I really encourage you to reach out to admissions at functionalmedicinecoaching.org and ask if you can be connected to an alumni. We are happy to do so. We actually have a ton of volunteers of alum and current students who say that they love talking about FMCA, their experience. They want to share. They want to certainly support and help someone else out. And so if you would like to be connected to someone, we are more than happy to make that connection, so you can start to build that community where you're at.
And many places their graduates are forming their own associations. One just started in Australia. There's another one in South Africa. And if you happen to be from a country where it's just you starting out, kudos to you. You are the pioneer, and therefore you will transform the health of people in your country. And we started the talking about designing your dream. And so I would encourage you to be bold, to have, just like I have that bold statement when asked, what do I do? And so the time is now to start that. And as you start, if you enroll in FMCA, time will help you to start creating and then living that dream once you design it.
Yeah, and just to add to that, we do have people who have started in countries that have never even heard about functional medicine. They brought functional medicine specifically. I'm thinking of Anandita from Mumbai, India. And so please don't let that hold you back at all. And again, feel free to reach out to someone in admissions. We're here to support you, provide ideas, insights, connections as well. So just
And
keep moving forward.
And
Yes,
start by volunteering, be a giver first.
yeah,
And we had a great example in the UK where someone did that and now they're hired as part of the National Health Service. So it can happen, it is happening.
absolutely. So we'll just do one more question, and then I've got a couple little things to share with you, and then we'll sign off for the evening. But the last question is, would this certificate allow me to start working as a health coach right away?
So right now there are no regulations for health coaching. In other words, anybody can hang out a shingle and call themselves a health coach. We would not encourage that. And that's why the National Board for Health and Wellness Coaching was established, so that they can assure the public that there are some minimum standards. So my answer to your question would be, it depends. It depends on your background, depends on your training, depends on what you want to do. So a great way, and I love your eagerness to start now, yay! What can you do? Well, you can volunteer to have us to listen to people. And there's something that's peer-to-peer coaching. You don't need to have anything formal for that. And so as a volunteer, you can serve your community. You can listen to people, hear what everybody wants to be heard. And so that if you did that, you are already coaching. And then we will help you to set up your business and look how you can transform and take it to the next level.
Absolutely. And so in closing, I want to just share that, first of all, thank you all for coming on tonight and for all of your wonderful questions and for your presence. We certainly appreciate it. And for those of you who did register, you will be getting the replay in your email tomorrow, along with a little gift, which is going to be a $500 off promo code for you to use. And this will all be in the email, but just to let you know, it is all caps open 500, and you'll be able to utilize this code until June 22nd. So that will give you $500 off the standard tuition. So all the details will be sent to your inbox tomorrow, along with this recording. I just want to say thank you again. You all have something wonderful and special to offer to this world. Keep listening to that and opening your heart up to that. And we are happy to help just take the next step with you. So please email us. You can contact us on our website, or email us at admissions@functionalmedicinecoaching.org. I look forward to connecting with you all personally. Sandy?
Thank you all. I am honored that you took the time out of your busy lives to be here with us, and we're here to serve you. And I just want to remind you that you are all meant for great things, meant for more, to create your dreams, to go out and serve the world, because the world needs you right now. Bye now. Thanks for being here.
Bye-bye.